Okay, so you've just had your excision, repair, or biopsy done with us here at Visage. So I'm just going to go over those post-op instructions with you. So depending on what you've had done, it may vary slightly, but in general, these are going to be the instructions to follow unless if we've told you anything otherwise at your appointment with us here. For the first 48 hours, you're just going to leave the site alone. You're just going to make sure it's kept nice, clean, and dry. After 48 hours is when you can start cleaning the area with a mild, non-scented soap and warm water. You can do this twice a day. And as well, you're going to apply an Aquaphor ointment twice a day as well to the site. Depending on where your stitches are, if you do have stitches, these are going to come out anytime between 5 to 14 days. This is something we would have told you at your appointment, and we would make a follow-up accordingly. So whether that's the 5-day follow-up, 7-day follow-up, 10-day follow-up, we would have let you know. We'll book that before you leave, and that's when your sutures will be removed. If you have steri strips on the site, just leave them on there. Let them fall off on their own when they're ready. If we've used glue stitch on your area, just make sure to keep it dry. The area can be washed, and then when you're drying it, just pat it dry with a cloth. Make sure not to rub the area at all, as we don't want to open up that incision site. Things to look out for would be signs of infection, so any redness, increased swelling, tenderness, any pus drainage or foul smelling drainage from the site. If you have fevers or chills, these are all things we want you to notify us of right away. So during regular office hours, you can contact our front desk. Anything after hours on the sheet here that we would have given you at your appointment would have a number that you can contact in the evenings and on the weekends. We also ask that within 14 days of your appointment with us, if you happen to go to emergency for anything non-related to your procedure with us, that you just let us know. That way we're up to date on your health. Shower-wise, you can shower 24 hours after your procedure. Just make sure it's lukewarm. We don't want anything steaming, as that can increase your swelling. For pain-wise, if we prescribed you something, you can take what was prescribed as directed on the bottle. Otherwise, Tylenol or Tylenol Extra Strength are both great options. We just ask that you stay away from something like Advil or naproxen, as these can increase your bruising and swelling. So to avoid these for the first 5 days. If you are having swelling, you can ice the area as well. So 15 minutes on, 30 minutes off. With your ice pack, just making sure you're wrapping it in a cloth or some sort of barrier so the ice isn't directly on your skin, as we want to avoid any chances of frostbite or things like that. If you're one of our patients from Dr. Esmail's ENT clinic, you will as well have a follow-up with him in 6 weeks. If this has not been scheduled yet, just make sure you contact Lucy at his ENT office. The number is 204-943-0629, extension 5 to book your appointment. Otherwise, that's pretty much it. If you have any questions, you can always contact our front desk. Thanks for choosing us, and happy healing.